joining. This is Amanda Armagast. Welcome to Essence of Medicine. Today we're going to talk about medical terminology.
I'm Dr. Abbasi, and we have a new, I wouldn't call it guest anymore, Michael. You want to introduce yourself?
Yeah, my name is Mike. I'm a PA here now. Still waiting on licensing and everything like that, but going to be a new member of the team. So right now I'm just doing a clinical assistant role around the clinic.
So what's your last name, Michael?
Jaeger.
Jaeger.
Yeah.
How do you spell it?
Jaeger.
But it's Jaeger.
It is Jaeger.
Not Jaeger.
No.
Why? Why is that?
German.
It's German. You know what that means, right?
Hunter. I do.
Hunter. It means hunter.
And
so
it's anglicized too because it's Jaeger instead of JA with the umlaut.
Umlaut. Yeah. So you're well versed in the German language. Now, how many generations ago has it been that you came to US?
I want to say four.
4 generations.
As far as I know, I'd say about 3 or 4.
Okay.
So we're going to spend about the first 10 minutes talking about basic medical terms, and then the next 20 minutes talking about spine-related medical terms.
Yes, but that has a relationship. Why I'm asking Michael about the origin of his name, because the origin of most of the medical terminology, they come mostly from few languages. What language do you think, Amanda, most of the medical terminology is coming from?
Latin.
Why from Latin?
I just feel like a lot of things come from Latin.
A lot of things
Yeah.
come from Latin. Now, actually, the old doctors were Greeks, and when Rome become very strong, they went and enslaved most of the Greeks. As a matter of fact, most of the doctors, handymen, plumbers, people who could really do things, they were Greek slaves. And so they took as well all the knowledge from the old Greek. So most of the medical terminology is actually Old Greek, not the Greek that is spoken now, but Old Greek. But through the enslaving the whole Greek by the Roman, the Roman took those terminology, they changed many of that, and then they spread it across the Europe. For a very long time, the Latin was language of science in the whole Europe. For that reason, most of the terminology is Latin.
Mm-hmm.
But there's lots of other language. One other language has a lot of influence on our medical terminology. What language is that?
So I always thought Latin and Greek, but
but there's one more language.
German.
German, yeah. German was the science center of the world from 1600 to 1800, actually to 1900.
Who's the science center now of the world?
We are.
Are we?
Well, for sure we are. Just look at the Nobel Prizes, the paper published, the institution, and so on. That is no doubt since the 20th century, beginning of the 20th century, but latest after the Second World War, there is no comparison to that. So, but until then, German was a big. So many of the words we are going to discuss, they have Greek origin, they have Latin origin, but many more advanced medicine terminology is German.
Mm-hmm.
Okay.
That's like, this is a little fun fact, why ECGs are called EKGs.
Yes.
It's a German invention.
What is it called? What is the real name of it?
Electrocardiogram.
But cardio in German is written with K.
Yep.
Here you are.
So that's why we call them EKGs instead of ECGs, and even though it's still in English.
Yes, yes. Okay, so how do we go about this, Miss Amanda?
Well, my main reason for wanting to do this specific topic is mostly to just make it easier for patients to understand what they're going through and what procedures are being done on them and so on. But I think we can start with some basic prefix and suffixes of common medical terminology.
So you want to go through it, and Michael explains that, and I throw some stuff in it.
Yeah.
You go ahead.
So I guess I'll start off with the prefix a or an.
So that means without or not. Usually it will, proceed. It'll be at the beginning of the word and it'll be a something.
So what would be an example of?
The one I'm thinking of right now is way more complicated. Anemia.
Okay.
Asystole.
Yeah, asystole. I was thinking of the one that popped into my head was anisocoria.
Anisocoria.
And
Yeah.
but I was
What
like,
does that mean?
so it means unequal sized pupils.
Yeah.
Break it down. An is not, and then iso is same, and then chorea means pupil. So not same pupil if you break it
Not
down.
same pupil. Yeah. Many of this stuff is regular talk in Latin that we now using as, we could as well say both pupil, not same size.
Yeah, it sounds pretty goofy.
Yeah.
Yeah. Converted
Okay.
it to English.
But we use that as well in English. That's nothing special. Anomaly.
A lot of these I think are pretty common in English
Yeah.
or other science things. When
Okay.
when I first saw A or an, I was thinking anterior. What is,
Anterior.
yeah.
Well, I think we should talk about the spatial kind of nomenclature all at once. Do you want to talk about spatial? Because I think it's important.
Yeah, do that.
Yeah. So imagine, Amanda, you are going to be our model for this,
Thank you.
Here is front, we call it.
Anterior. Posterior.
The back, we call posterior. Top
Superior.
and down.
Inferior.
But for human, we have, or for all animals, we have as well another name for that. We call toward the head.
Oh yeah, caudal.
Caudal is toward the tail.
Yeah. And cephalad. Cephalad starts.
Or cranial or cephalad. Okay. Yeah. So these are different names for orienting ourselves. Now, if we, these are all spatial kind of nomenclature. If we wouldn't do that, but if we would cut Miss Amanda horizontally and look up, what kind of plane is it when we cut it this
Like
way
a,
and look up?
a transverse plane.
Transverse plane, or we call it in most of the imaging, we call it axial
Yeah.
beams. Okay. Now, again, we wouldn't do that, but if we would cut Miss Amanda right through her ears and look inside her brain, what we would do, call that?
Coronal.
Coronal.
Mhm.
And what about if we cut through the nose, from nose back all the way down in the middle?
Sagittal.
Sagittal. These are the terminology that we use to identify what the orientation of a picture of an anatomical thing is.
Okay.
Now, there are some others, but they are less important, like ventral. What does that mean? What does that mean, ventral?
It's like the front, but I think of it more.
Toward the belly.
Yeah, towards the belly. And I think
Yeah.
of it more with like fish because they have the ventral fins and things like
Yeah, toward the fins, toward the belly.
Mhm.
That's what it means, ventral. And then obviously in specific location, we have some other terminology, but that would cover most of the spatial
Mhm.
terminology.
Okay. So we'll go back on with the prefixes. Dis.
Means like bad. The one that I think of is dysmenorrhea, so that means like bad periods. That's just the first one that pops in my head. So
Oh, that is a funny one to pop in your head.
I don't know, just popped in my
Dysmorphia.
Dystrophy.
Dystrophy
Okay. Hyper.
means
That's my children.
Yeah. Overactive.
yeah, a lot of people probably can relate to this, but being like hyper is like over, extra, a lot.
Mm-hmm. And then
At the-
hypo.
Opposite of that.
Opposite of that.
Yeah.
Yeah.
Okay. We're going through these really fast
People
because
think about hypothermia, so low thermia, which is heat. So
Oh.
low heat, yeah,
yeah, okay. Macro,
big.
micro.
So everybody knows that micro
Yeah.
means small,
Mm-hmm. Especially if you've taken economics. Post.
like behind. So we kind of talked about the spaces a little bit, anterior, posterior. So
Yeah.
post is behind
Or after.
or after.
Or after something, usually it calls like a postmenopausal person is somebody who had the menopause behind herself.
Why is spatial different? Because now I'm seeing pre is in front of or before. Why is it not preterior and posterior?
Preterior and posterior. I never thought of that. Why they would do that. But
Pre and post.
pre and post is the event. This is an event.
Okay.
Like, pre nuptial is
Mhm.
Before
what you do before you marry. postnuptial is you do what you after you marry.
Okay. And then retro.
Ooh,
We all know
I
that
mean, you
one.
should know
Yeah.
that.
Yeah.
Hey.
You go too
I know.
often to Google too often to thrift stores. You should know
Disco
that.
balls.
Yeah.
So those are some basic prefixes. If anyone else wants us to go more deep into these medical terms, we will just
So
comment.
retrograde amnesia. What is that?
So that's amnesia from before the event happened. So if you fall and hit your head and you can't remember anything from before, you forget where you're from and forget your name, that's retrograde amnesia.
Well, usually that would be bigger deal, but the retrograde amnesia in this context meaning that I hit you on the head,
Mhm.
you forgot what you ate for lunch,
Mhm.
because from the moment that incident happened,
Mhm.
it goes back to certain point. I hope it doesn't go all the way back to the point that you knew your name,
Yeah.
because that would be very severe form of retrograde amnesia.
Yeah. Yeah, I suppose it doesn't. Hopefully, you don't forget everything, but you never
Yeah.
know. I feel like that's what happens in the movies where people always get amnesia. They don't remember anything.
That's an interesting story that we can talk about with that patient HM, Henry Molaison. That is, we should do actually another podcast just about the memory. And in that, we should definitely talk about that retrograde amnesia and that very famous patient HM.
Yeah, we'll do that. Sure. I want to get into spine terms now. This is what I'm most excited about because I have a lot of questions. So I'm just going to go down this list, and sorry if I butcher any of these words.
Go ahead.
Okay. I'm going to start off with a hard one. Radiculopathy.
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 So that's when you have usually some sort of injury to a nerve, but it usually follows a certain pattern.
Okay.
Well, pathy means something is wrong, a disease, something that is not, that we have something that in our body is not working. That's practically pathy means. Like pathology means the knowledge of diseases.
Mhm.
And
Radiculopathy, radiation, like
okay.
pain that goes in a certain area down our leg. Radiculopathy is reserved for a pain that follows the practically path of a very specific nerve.
And so how does this commonly look in your patients?
That they have pain going down to the big toe, but nowhere else.
Okay. Myelopathy.
Myelopathy. Ooh, we could talk 2 weeks about myelopathy. Go ahead. What do you know?
Yeah, that's usually some sort of severe nerve compression that usually when someone's myelopathic, that's what we would consider a surgical emergency. If I saw someone in clinic and I thought they're myelopathic, I'd probably be on the phone with Dr. Abbasi pretty quick, because it's severe compression of a nerve, usually the spinal cord, so much so that if it doesn't get fixed soon, people can permanently be damaged from it.
So, and yeah, pretty good. Now, our brain talks to our muscle or anywhere in our body when it talks to them, when it tells them to do something with 2 neurons. One neuron, the cell is in our head, and the path, the axon, goes all the way to the spine. Then it tells to the next neuron what to do, and then the next neuron, which is in our spine, goes all the way to our big toe. Now, if we push on the second neuron, we get radiculopathy or problem of that is in that area. But if you push on the first neuron, we get myelopathy. They have different clinical presentation, different symptoms that we have to figure out what is what. And obviously, it makes sense. The first neuron is in our central nervous system. That's very important, path. That if it's pushed, that is more severe, more consequential.
And so myelo, is that?
Myelo means the spinal cord.
Okay. Neurogenic claudication.
So claudication is a term that refers to pain with walking. And I guess when I was doing a lot of review recently for my board exam, we always think of claudication as being a problem with your arteries, but the term neurogenic means it's a nerve problem. And so this is when you kind of have some weakness in your nerves, you get pain when you're walking for extended periods of time, and it's from a nerve source, whereas something like regular claudication, I think of as like peripheral artery disease.
Yeah, but now claudication, as you said, is practically a vascular disease. That what claudication means actually is that you start walking and after a while you cannot anymore.
Mhm.
That's what it is.
After a while, meaning after a few minutes or after like
Some people after a few
hours,
seconds, some people after a few minutes. If it's few hours,
then
then we don't usually, that's okay.
That's pretty normal.
yeah.
That's pretty normal.
Okay.
Okay.
If
But-
you find somebody who's really sick, who has some really occluded arteries, people sometimes can't walk out to their car because the
Yeah.
blood flow to their legs starts to get obscured.
And they become ischemic, they
Mhm.
become anoxic, the limb become anoxic. Now,
Anoxic meaning
not anoxic.
Well, let's break it
for
down.
no, oxic,
no
Oxygen.
oxygen
no oxygen
to the leg.
to the leg. Yeah.
And
because
no oxygen hurts
Mhm.
anywhere in the body. If you have any ischemia to a muscle, ischemia also means no oxygen to a muscle. It hurts really bad.
Is that similar-
It's interesting. Anoxic is Latin, ischemia is Greek. Here you are.
Is that similar to if you got like a string tied around your finger really tight and then it starts hurting and like getting swollen?
When you get that in cold, and then what happens? Your first cold, when you come back in, it starts throbbing
Mhm.
because in the cold, the vessel clamp down and your finger don't get enough blood supply. But when you come back in, the nerves as well are numb. But then when you come back in, a little blood that start going in wakes up the nerve first, and the nerves are telling, there's not enough oxygen, do something. Ischemia, meaning not enough blood,
Mhm.
Okay.
okay?
So I'm going to go to more like commonly heard ones during our testimonials. Stenosis.
So that's narrowing. So the stenosis in general just means narrowing. In our case, we're concerned about spinal stenosis. So you get narrowing of the spinal canal. And these people, we call it the shopping cart sign. So they'll walk a lot of the time on a walker, like as though they're pushing a shopping
Mhm.
cart, because their spine will hunch over and it opens that canal in their spine a little bit to give them a little bit of relief. But that's just usually it's related to age. People get older and they get some degeneration of their spine and they just see that spinal canal start to narrow and it causes them problems, and hopefully we can fix them.
Well, as you said, stenosis is a general term for narrowing. It can be from esophagus, from bowel, or there's some other term, mostly arteries. Anything that is like a pipe and something passes through can be stenotic.
Mhm.
For us, spinal cord is that area, or foramen
Foramen, yep.
or lateral recess stenosis. These are different areas that can be stenotic.
Okay. This one's a little bit complex.
Ooh, I love it.
Spondylolisthesis.
Spondylolisthesis.
Yes.
Spondylolisthesis. What is that?
So spondylo is vertebral body,
Mhm.
and then listhesis means to slip. So it's the vertebral body will start to slip. Again, can be from a degenerative condition, can be from trauma, but
Is there ever normal? Is listhesis ever normal?
you're the neurosurgeon.
So there is a physiologic C3-4 spondylolisthesis. So especially younger people, we know that just without having any complication, they can move a little forward and backward. But beside that, it's always a bad sign.
Mhm. And I was actually going through a PowerPoint on the company drive recently and learned that a synonym for spondylolisthesis is anterolisthesis.
No,
So,
anterolisthesis if it falls forward.
mhm.
Retrolisthesis, we just talked about that if it falls backward.
Yep.
So anterolisthesis, retrolisthesis, or but in the both are category of spondylolisthesis.
Okay. And then what about Spondylos.
Spondylosis.
Spondylosis.
What is that?
Osis means condition. So spondylosis means condition of the vertebral.
What exactly is it though?
Spondylosis isn't that just more of a sort of arthritis degeneration?
Hmm.
It's a less specific term
It
usually.
is less specific, but let's make it as specific as we can explain it. So this is the bone. What is between the two bone in vertebral body? What's between them?
The disc.
The disc. If the disc does its job good, then they bounce against each other. But what if it doesn't? They hit each other.
Yeah.
What does a bone does when it hits things?
Damages it.
Damages it. But when it damages, then it starts growing in the wrong places.
Mhm.
That piece of bone that grows in the wrong places is a very good indication that there is a problem there.
Mhm.
And that is what mostly is called spondylosis. When the edge of the bone, those bone spurs, those
Mhm.
osteophytes growing
Osteophytes.
in all the wrong places, then we can say the patient has spondylosis.
Let's break down the term osteophyte.
Yes, thank
Osteo.
you.
Okay.
Osteophyte, people call them bone spurs. That's a good way to think of them.
Osteo is in bone.
Osteo is in bone. Nice. And then phyte means physis, or phyte means to grow.
Okay.
So, and I think if you go even deeper back before grow, it means plant. Phytochemicals. So physis means to grow. So osteophyte, bone growth. And that's from those vertebrae knocking on each other.
You are now phyto or osteophyte. Fight. Is it Greek or Latin?
I'm gonna go with Greek.
Yeah, pH. All the pH and
sounds-
TH. All the pH and TH are Greek. If you see a medical terminology with pH or TH, they're all Greek.
Mhm.
Those of you studying, keep that in mind.
If you're studying for any sort of medical exam, learning good medical terminology is so helpful.
And if you need a study buddy,
What?
tell us and we will make a podcast about your study.
Okay, let's do it.
Let's go into our LinkedIn drama, lordosis.
Oh, several doses. I hope he's not watching
I hope
us.
he is watching.
What? Why do you want drama?
I don't want drama. I just want
Okay.
them to enjoy our podcast.
Excellent. So, what are the natural curvature of our spine?
So you start at the neck, the cervical area. Cervix means neck. So that's has a natural lordosis, which is a sway back. Then you have
The neck, the vertebral body sway forward, right? In the chest sways backward. It's
I
like
guess
here.
okay.
here.
You were thinking
Forward,
about it from
backward.
different angles.
Oh, I see.
yeah,
okay.
yeah. So I'm thinking of it
Face on.
like so it sways back like that, and then there's a natural kyphosis of the thoracic vertebrae,
So
and then a natural
here.
lordosis of the lumbar.
this is nose, this is eyes.
Yeah.
In the neck goes forward, chest backward, lumbar spine forward. So
Lordosis, kyphosis.
so here. Not sure if you guys can see that.
Do you want to can you hold it up
Ooh,
to the TV, Alyssa?
yeah.
Thank you.
Maybe we need a darker pen.
Yeah, just hold it closer. So nose, eyes, and then in the neck, spine bends forward, in the chest backward, and in the lower back bends forward again.
So lordosis is natural in the lumbar area and the cervical area, and then kyphosis, humpback, is natural in the
To a certain
to,
degree.
to a certain degree.
So what does that mean to fix the lordosis?
So they mean that if in the lower back, spine doesn't have the natural curvature, do something to
Make it as
recreate that
close.
as close to normal.
Okay, so during a traditional spine fusion, how much blood do you lose?
Traditional.
Mhm.
I have done over 3,000 traditional spine surgery. There is a medication now that helps you to reduce that blood loss. It's called tranexamic acid that make the blood clot faster. It's a good medication because before that, the usual blood loss for a one-level fusion could be easily a liter. A liter is you have something there that
Well,
shows.
we're showing, how many cc's is this, Alyssa?
These are two.
Uh,
This is about 1,000 cc's of blood. It's not real blood. It's actually Kool-Aid.
But this is 1/4 of your body's blood. This is 1/4 of it.
So this is how much you
For
would
one
lose
level.
in a traditional one level spine surgery.
Yeah.
And Dr. Abbasi has been working on perfecting another kind of surgery. It's minimally invasive. This is about how much blood you lose during that surgery.
Can I drink that?
You can actually, yeah, we made this. Wait, just show the people first. OLIF versus traditional blood loss.
I'm going to chug
To
up
prove
my
it's not blood,
animal-
so we don't get taken down.
Yum, yum.
The thing
So,
is, we actually
44
knew he
cc
was.
of blood is gone.
You're gonna check these ones too.
No, I'm not going to chug a liter of.
That's so on brand for you.
That is even unhealthy to drink it at once. How unhealthy do you think is to lose it at once? But with tranexamic acid, we can reduce that. But tranexamic acid make the blood clot not only in the wound but everywhere. So you may have stroke, you may have other problems. So we don't use any tranexamic acid, and we still lose about 44 cc of blood per level.
You're just talking so fast now. I can tell the sugar from the
Yeah,
Kool-Aid
sugar
kicked
is
in.
coming to you.
Yeah, it's
Hyper.
Hyperglycemia.
So I hope you guys love my my butterflies too. Okay.
Okay, any other words you guys want to
Do we have
cover?
any other
We have quite a few.
yeah.
I have
feel like-
one thing I want to talk, which is craziest thing.
Okay.
Okay. Should we, let's do that. Do you want to go a step back because I want to examine Michael. Michael, hold your hand, turn them back and forth. Now, if you couldn't do that fast enough, if we have a name for that. If you are slow, we would call it brady.
Mhm,
If you cannot do it at all, we would call it A or none at all.
mhm.
But what would we call that?
Dystocokinesis.
No, bradydiadochokinesis.
Dang it, I was close.
Yes, you were very close.
Brady.
Brady for slow or adiadochokinesis. Kinesis at the end means motion.
Mhm,
A means no or brady is slow.
mhm.
But diadocho, what does that mean? After Alexander Great died, he didn't appoint anybody who as his successor. So all his generals fought each other, and every few years another person had the power. It was rapidly changing. So diadochos is the word now for rapidly changing anything.
Huh.
So no rapidly changing kinesis motion or slow rapidly changing motion. And that's a sign of the cerebellum problem in our back of our brain, which controls this motion. You could do it. You don't have a problem in your cerebellum.
Yeah, I'm glad.
Yeah. Okay. Well, Miss Amanda, come back here. What else do we need to talk about?
We're on to our next topic.
Oh, wow. Okay. So we are going to just close this session then?
We're gonna close off and take note of all the comments that we have and do a part 2.
Okay. Well, thank you very much for joining us. I'm Dr. Abbasi.
I'm Amanda Armagast.
And I'm Mike Yeager.
Thanks, guys.